Hello and welcome to my presentation over strokes. I'm Benjamin Stephenson. We will start by defining what a stroke is, and it is a medical emergency that happens when something prevents your brain from getting enough blood flow or oxygen. A blocked blood vessel or bleeding in your brain can cause a stroke. There are two main types of strokes, including the ischemic stroke and the hemorrhagic stroke. The ischemic stroke is the most common type. It occurs when a blood clot blocks an artery in the brain, which interrupts the blood flow and oxygen, while a hemorrhagic stroke is caused by bleeding in the brain due to a ruptured blood vessel, rather than a block or a clot. So to get into some of the epidemiology, strokes are the second leading cause of death worldwide and fifth in the United States. It's a pretty big issue. Every 40 seconds, someone in the United States has a stroke, and every 3 minutes and 14 seconds, someone in this country dies of a stroke. That's a lot. So about 87% of all strokes are ischemic strokes, in which blood flow to the brain is blocked. Also, the strokes are the leading cause of serious long-term disabilities. So the classic symptoms for a stroke can fall under the FAST acronym. They can have one or all of these acronyms, but the first one is face drooping. A stands for arm weakness, S for speech difficulty, and T means time to call 911. Whether they're having one or all of these, it is a classic symptom of a stroke. Some other symptoms of the stroke include vision issues, dizziness, sudden confusion, severe headache. And with these, there's usually a sudden dramatic onset. They're happening at dinner, at lunch, within 30 minutes, within 20 minutes. They're not happening over the course of a day. These symptoms aren't getting worse like a migraine. They're sudden, fast, and they're negative, meaning the symptoms are negative, meaning they involve the absence of normal functions. The main anatomy affected is the circulatory system, as there are various arteries that originate from the circle of Willis in the brain, and they provide blood supply to the brain, but they're vulnerable to blockages and ruptures, which lead to strokes. For ischemic strokes, there is a reduced or blocked blood flow to a region of the brain, which leads to a lack of oxygen and glucose supply, which leads to a cascade of exotoxicity, oxidative stress, and ATP depletion, culminating in brain cell death. While hemorrhagic strokes involve a bunch of blood in one area, pooling in one area from the open or busted blood vessel, and this extra blood irritates, damages, and compresses the surrounding blood tissue. This increases the intracranial pressure and potentially reducing blood flow to the affected areas of the brain. At a cellular level, the oxygen and glucose deprivation lead to cell death, and in the brain, that's very bad. To diagnose a stroke, the gold standard is a brain CT scan. So this determines whether there's bleeding within a brain or damage to the brain from a stroke. They can also use an MRI with a CT scan or an MRI alone, but it's not going to be as good as a CT scan to find the stroke, find out what's going wrong. There are also blood tests and ultrasound devices that can be used, but ultimately a CT scan is what you're looking for as the gold standard. For treating an acute ischemic stroke, if you are able to get care in under 4.5 hours, then there should be a medicine, TPA, that they can use as an IV medication, and this will restore blood flow by dissolving the clot, which caused the stroke. There are endovascular procedures as well, which uses a catheter to deliver the TPA directly where the stroke is occurring to remove the clot with a retriever, and these are used whenever maybe the 4.5 hour limit is up. For a hemorrhagic stroke, the first line is medicines used to lower blood pressure, any anticonvulsants, or if they're on a blood thinning medication, reversing the anticoagulants will help. And surgery would be the last approach, and it involves relieving pressure of the brain or removing the hematoma using decompression, craniotomy, aspiration, whatever they can do to relieve the pressure in your head and get blood flow back to normal. The rehabilitation for a stroke, like any injury, varies case by case depending on severity. The rehab focuses on regaining lost skills and improving independence. They use physical, occupational, and speech therapy tailored to specific patient needs, as they may need all three. The goals of therapy include restoring physical and cognitive as well as emotional well-being to improve one's quality of life post-stroke. From the outcomes, we can see how serious strokes can be, as only 10% make a complete recovery, 25% feeling some impairment still, and 40% having severe impairment. 10% require long-term care, meaning they can almost do nothing independently. Stroke survivors also have a significantly higher risk of death after their first stroke, whether it's another stroke or any other potentially life-threatening illnesses. Hemorrhagic strokes have poorer outcomes than ischemic strokes, and they are commonly dependent on the time between the onset of symptoms and the intervention. Mortality rates are consistently declining due to better care and management, while on the other hand, a rise in young adult strokes due to increased risk factors like obesity and hypertension. These are the two common trends we're seeing in strokes. The main things you need to take with you about a stroke are the FAST acronym: face drooping, arm weakness, speech difficulty. You know it's time to call 911. And you know it's time to call 911 because time is everything. The quicker the care, the higher chance of survival and reduction in long-term disability risk. And again, strokes are preventable. By managing risk factors and adopting healthy lifestyle changes, you can lower your risk of having a stroke. Remember, FAST.